Today, we're going to put on our detective hats. We've got a patient in distress, a bunch of clues that don't seem to add up, and a diagnosis that hinges on spotting what isn't there just as much as what is. So let's dive in.
Okay, picture this. You're in the ER. A 71-year-old woman is brought in clearly in some kind of neurologic crisis. Her glucose is so high the monitor can't even give a number. It just says high. You know the clock is ticking. So what's your first thought? What's at the top of your list? That is the mystery we're going to solve today.
All right, to solve any good mystery, you have to start with the facts. So let's open up this case file and see exactly what we're dealing with here.
Here's the rundown. We've got an older patient, and she has two super common conditions: type 2 diabetes and high blood pressure. Now, her husband gives us a really important clue. She just recently had a UTI. Go ahead and tuck that detail away. Trust me, it's going to be a big deal later on.
Now, this is our first major clue, and honestly, it's a bit of a weird one. For a patient who is this sick, with a blood sugar that's off the charts, you'd probably expect to see some crazy rapid breathing, right? You'd think her body would be in total panic mode. But nope, her breathing is completely normal. This isn't just a minor detail. The fact that a key symptom is missing is a huge signpost, and it's pointing us away from the most obvious diagnosis.
So we have our initial facts laid out. Now the real work begins. We need to take every single piece of this puzzle and figure out what it's really telling us. Let's follow the evidence.
The first huge clue is her specific diagnosis: type 2 diabetes, not type 1. You see, in type 2, the body is still making some insulin. It's not enough to keep her blood sugar in check, obviously, but it's often just enough to stop a whole other kind of metabolic meltdown from happening. This distinction is basically the fork in the road for our entire investigation.
Remember that UTI we talked about? Well, here's where it comes roaring back. An infection puts a massive amount of stress on the body. And on top of that, it often makes people not want to drink fluids, especially older patients who already feel pretty awful. This combination, physical stress plus dehydration, is a classic trigger for a diabetic crisis.
And then, of course, there are the symptoms that brought her in: the confusion, the slurred speech. You've got to understand, these aren't just side effects, they're the main event. This tells us that whatever is going on is so severe, it's directly impacting her brain and her central nervous system.
Okay, we've gathered our clues. Now, just like any good detective, we need to line up our suspects and start crossing off the ones that just don't fit the evidence.
So when you hear diabetic emergency, what's the first thing that pops into your head? For most people, it's diabetic ketoacidosis, or DKA. It's definitely the most common suspect, the one everyone knows about. And yeah, with that super high blood sugar, it's a pretty reasonable first guess. But does the evidence actually back it up?
And this is exactly why DKA is the wrong path. Let's look at this side by side. Our patient has type 2 diabetes. DKA is way more common in type 1. Her breathing is normal. DKA causes this very specific, deep, rapid breathing as the body tries to get rid of acid. And her main symptoms are neurologic, whereas DKA usually comes with things like belly pain. See? The puzzle pieces just don't fit.
So what else could be going on? Well, we could think about something like adrenal insufficiency, but she doesn't have any of the classic signs, like weight loss or weird skin changes. Or maybe it's just really bad dehydration from her infection. And yeah, she is definitely dehydrated, but that alone doesn't explain a glucose level that's literally off the machine's scale. Dehydration is part of the story, but it's not the whole story. We've looked at all the clues. We've ruled out the main suspects. All the evidence is pointing in one very clear direction. It's time to solve this case.
The diagnosis is hyperosmolar hyperglycemic syndrome, or HHS. Basically, it's a state of incredibly high blood sugar that makes the blood get really thick and concentrated. But, and this is the key, it happens without that significant acid buildup you see in DKA. And, you know, this is a surprisingly common yet often missed emergency for older adults with diabetes. So let's close the case file for good by confirming exactly why HHS is the perfect diagnosis. We're going to connect every single clue we've gathered right to this answer.
So here's the chain reaction. It starts with the infection and not drinking enough water. That causes her blood sugar to just skyrocket to insane levels. This makes her blood get super concentrated, almost like syrup. Now, to try and fix this, the body starts pulling water out of its own cells, and that includes her brain cells. It's this severe cellular dehydration inside the brain that's causing all the confusion and the slurred speech. It's just a devastating domino effect.
And when you lay it all out like this,
You could see how everything just clicks into place. Every single piece of evidence fits the classic HHS fingerprint. The patient having type 2 diabetes, that recent infection acting as the trigger, the crazy high glucose reading, the big neurologic symptoms, and of course that all-important negative sign, the normal breathing that told us it wasn't DKA. It is a textbook case.
So, what's the big takeaway here? A simple urinary tract infection, something that might seem pretty minor, spiraled into a full-blown, life-threatening emergency, all because of her underlying diabetes. It really makes you wonder, doesn't it? What other silent dangers are lurking out there, just hiding in plain sight, waiting for the right trigger to set them off?